Hi everyone, welcome to The Pulse. Today we're joined by Dr. Gerald Ledlow. He's our Dean of the School of Community and Rural Health. And we're here today actually to discuss the health status report for Northeast Texas, fresh off the press in 2021. The last time we saw this publication was in 2016, and it's been so useful to help guide our research efforts and our health efforts to help improve the lives of East Texans. Dr. Ledlow, thank you for your work, and just tell us a little bit about this report, who's been involved and how this came about.
Yes, we're happy to announce that the Northeast Texas Health Status Report of 2021 is now out and published, both online and hard copy. The report was really a team effort of faculty in Austin, Dr. Lakey, Dr. Nemi, Nagla Ilarian, along with faculty members here, Dr. Christian Alvarado and Dr. Paul McGahey and others. And really it was a team effort pulling all the information and the data together so that we continue to look at the health status of this region so that we can make programmatic and resource decisions that best improves the quality of life of the people in this region. This region has about 1.6 million people. And if you look at it as our own state, it would be about the size of West Virginia. It's 35 counties, and we do have health challenges, but the good news is there are some things from the report that we have improved on, and there are also some things we need to work on. But the real message here is read the report, take it in, and see where we can make a difference, a positive difference for the people of Northeast Texas.
I think this report's so important for so many of us, and so important for the strategic moves that we need to make to really impact health. Can you tell us about some of the areas that we've shown some improvement?
Well, one of the areas is we have seen a slight decrease in smoking, which will have positive influence on cardiovascular health moving forward. We also have improved overall in our health status. If we were our own state, West Virginia sized, for example, we would be 44th out of 51 states. So we have moved one place, improved from 45 in the last report to 44 in this report. But we still do have challenges, but we are making strides, and I think that first report gave folks in the community a look at where we are, and it really shone a light on some of the improvements we need to make in our communities with regard to health.
I know some of the areas in the past that they'd said we really needed to have some improvement in our mortality was in respiratory diseases, things like asthma, COPD, heart disease, stroke, cancer. I know that the work is vast. Can you talk about any areas that you think we also need to improve on? I know one of the things they had mentioned was just our overall exercise and just getting out there and getting moving.
I think there's 3 or 4 things we can really take away from this report. One is we still have a challenge with smoking and pregnancy. We really need to work on cessation, especially with that group, because it impacts the infant. We also need to really push the effort for primary care and continuity of care so that we can identify problems early on and also stay on track and know that we're making good decisions in our own lives. We need to have a better, healthier lifestyle, nutrition, eating better, eating wiser, and exercise. And that will lower some of the diabetes and hypertension issues. We also have one other issue that's very difficult to talk about sometimes. We have seen an uptick in suicide. So we need to check on each other. We need to check on our family and friends and others in our community and get them the necessary help if you see a problem.
Thank you. Please, we want to provide the resources so you can read and digest this report, just like you mentioned. This is really important information. This is also our life's work, right? To help improve outcomes for ourselves, for our families, for the citizens, and for the people that we love. So thank you for all of this work. We're going to use it, and hopefully when we report again in the next 5 years, we're going to show a lot of improvement.
Yes, we're here to improve the health status of this region, and this is a step in that direction.